Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. When a person completes rehabilitation after a traumatic brain injury, a loved one often takes on the role of their caregiver. For help understanding what this may involve, I'm talking with Upstate neurotrauma nurse navigator Melissa Port. Welcome to the Informed Patient, Nurse Port.
Hi, Amber. Thank you.
A report from the Brain Injury Association of America says 11.4 million adults live with a disability related to a traumatic brain injury. Can you discuss the range of disabilities this may include?
Yes, each traumatic brain injury is as unique as its recovery process. Recovery will look different for everybody. All traumatic brain injuries can create challenges, and some of these might become long-term disabilities. Common disabilities range from headaches, sensitivity to light, sensitivity to sound, confusion, mood or behavior changes. A traumatic brain injury can also change aspects of your everyday life. We refer to them as activities of daily living, or ADLs for short. And those are simple everyday tasks that we do, such as getting dressed, walking, or driving.
So it sounds like could be very individualized, some people with minimal disability and some with major disability.
Absolutely. It depends on the extent of the traumatic brain injury itself. It also depends on where in the brain you're affected from the injury.
Now, how soon does rehabilitation begin and how long does it typically last?
Rehabilitation for patients will begin in the hospital as soon as they're hemodynamically stable for our team of therapists to start working with them. And by hemodynamically stable, I mean their heart rate is good, their blood pressure is good. If they had surgery, that has stabilized, so it's safe for the therapist to work with them. Our patients will see physical therapists, occupational therapists, speech therapists, and they have assessments and they continue to work with patients throughout their hospitalization, which helps case managers and social workers determine if the patient needs inpatient rehab, outpatient therapies. There's home therapies as possible discharge plans. Most of the severe and moderate traumatic brain injuries will require inpatient rehabilitation, and that can be acute rehabilitation. We have an inpatient rehabilitation in the hospital on the second floor, physical medicine and rehabilitation, also called PMR, which is, like I said, on the second floor of the hospital. Acute rehab generally will last 7 to 14 days with the expectation that patients will return home with family or caregiver support. Short-term rehabilitation is usually at a skilled nursing facility, and that generally lasts up to 21 days. It can extend if people need up to 100 days. With days 21 through 100, we'll have some co-pays.
I see. Now, in your role as a neurotrauma nurse navigator, part of what you do is try to help ease patients and whomever's going to become their informal caregiver into the next step of recovery after hospitalization. And that seems like it could be a big transition. What's involved?
It can be, and it does depend on the situation. Like we were talking earlier about the traumatic brain injury itself and how it affects an individual. This is individualized as well. A lot of what I do is to spend time talking with patient support systems, which can range from family, their significant other, or their friend. It just depends on who is involved in their support system and who is willing, to help out.
Are caregivers usually family members, or do you often see that it's a friend?
It depends. It depends on what the patient's life is like before admission, because that will affect their care when they're discharged from the hospital and rehabilitation. So if they only have friends or neighbors in their life, that could potentially become their support system. If they live with family or have a large family, brothers, sisters, a spouse, children, they can become their caregivers as well.
Does the caregiver need to have a background in medicine or healthcare?
S- No, they don't. The term informal caregiver means that somebody does not have any kind of formal training or education. And in the hospital, and I have heard of rehabilitation facilities, they'll work with patient support system and their caregivers to provide some skills training. If people aren't ambulating or walking well, they'll kind of give them cues to help people with their mobility, body mechanics, making sure that they stand up straight. If they're using rolling walkers, they'll give them some education for that. They're also educated on medications because we want to make sure that there's medication adherence. Sometimes a traumatic brain injury can cause memory issues, so you're not remembering to take care of your medications. So the caregivers are educated on the importance of that as well.
What do you think a caregiver needs to know before volunteering or being volunteered to become the caregiver? What are they getting themselves into?
That's a great question. And, I will say that the Brain Injury Association says that there's 65 million family caregivers in the United States alone. And according to their statistics, 23% of those 65 million are providing care for somebody with a brain disorder or a brain injury. That amount is staggering. That's a lot of caregivers. It's important for caregivers to know that a brain injury recovery is not linear, so it doesn't follow a straightforward line and path. There's no time frame for recovery and there can be setbacks. I think it's very important for people to remember that, and I think it's important for us as healthcare providers to make sure that caregivers know that and patients themselves because it can get frustrating. One day somebody is able to put on their pants themselves and the next day they can't. That can be very frustrating. So it's important also for caregivers to take it one day at a time and not compare your loved one's journey on recovery and rehabilitation to somebody else and their particular journey.
This is Upstate's The Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with nurse Melissa Port, who is a neurotrauma nurse navigator at Upstate. In terms of the home itself, are there changes that may need to take place before the person comes home?
Sometimes it's as simple as you go stay with a loved one or a friend. If a person has a traumatic brain injury and they have to climb 12 steps to get into their home and they can't do that right now, um, then you might have to go stay with a friend or another family member. So the change can be that quickly right out of the gate, or sometimes patients need durable medical equipment, and that's like a rolling walker or grab bars in the shower or a shower chair. So it depends on, how the patient is physically getting around and doing things. Sometimes they might need a wheelchair, and then people have gotten temporary ramps. I know that people have gotten them on Amazon to help get people into their home. Sometimes they might need a Hoyer lift to help the caregiver transfer the patient from a chair to their bed safely. Sometimes they might need a hospital bed. For some homes, they might be two levels. So sometimes I've had patients and their families use their living room as a temporary place for them to stay and sleep while they're recovering. And for patients that can walk around, but they might be a little unsteady or weak, I recommend that people remove throw rugs or tripping hazards. And the most important is to create a calm and safe environment for the survivor of the traumatic brain injury.
How does the new role and relationship of caregiver and patient impact the former role, which might have been parent child or child parent or spouse or brother and sister or friends? It seems like this is going to change things, right?
It does. It does change the dynamics. After a brain injury, the survivor's focus shifts to recovery and learning new skills. And it also leads to reassignment of family roles. So if it was a parent affected by a traumatic brain injury, that role now might look different. They might need more help when last week they were taking their child to soccer practice. The change can be challenging for the caregivers because now they're taking on extra responsibilities. And it can also be challenging for the survivor because now they feel sad or distraught because they're giving up familiar activities. So it's common for there to be an adjustment period.
Can we talk about some of the financial aspects that relate to becoming a caregiver? I'm wondering if you see people having to stop work or school in order to care for someone who has a TBI.
Sometimes it all depends. I do get a lot of questions about financial aspects. There's the direct care costs of the hospitalization. There's indirect costs of any kind of changes to income if people have to stop working or if there's lifestyle accommodations, like you can't afford everybody having a cell phone and a home phone, so you forego the home phone. There's also possible out-of-pocket expenses. Health insurance does have some limitations on what can be provided, especially if long-term rehabilitation is needed. So I do recommend that caregivers contact the patient's insurance directly because they can help guide you on what they do and do not cover. As far as somebody having to stop work, sometimes the patient themselves has to stop work, which could be for a short period of time, or it could be that they leave the workforce completely because they can't safely and effectively perform their job any longer.
Do disability insurance policies help with some of the expense?
Sometimes they do. Another benefit is the Centers for Medicare and Medicaid Services officially recognized traumatic brain injury as a chronic health condition in 2024, and it took effect, I think, January 1st of 2025. This provides more opportunities for individuals to utilize disability insurance policies and to apply for Medicare. Individuals with traumatic brain injuries can enroll in Medicare Advantage chronic needs plans. And these plans offer coordinated Medicare that can include services like telehealth visits, meal delivery, mental health and wellness checkups, and sometimes medical transportation to and from appointments.
Now, what if the patient has no one in their life who is willing to become their caregiver? What happens then?
Sometimes we do have that happen. Sometimes we do have people that are homeless that have had a traumatic brain injury. If a patient doesn't have an informal support system, they might be able to privately pay for home health aides. There's also consumer directed personal assistant program through Medicaid if they happen to have Medicaid as their insurance. There might be an assisted living facility or a long term care in a skilled nursing facility as options.
Do you ever see where the patient is able to rehabilitate at home and then go back to their job if they've sort of put things on hold with their job? And if so, are there disability accommodations that might need to be made?
Yeah, again, it depends on the traumatic brain injury itself and if the patient feels comfortable returning to work and they're able to perform their job duties safely and effectively. And sometimes, yes, accommodations can be made at their job. The American with Disabilities Act defines disability in very general terms, and through the ADA, the Americans with Disability Act, a lot of employers can offer accommodations to ensure that patients can return to work effectively. The best path for that is to contact your employer. Some employers offer job coaches or counseling, and they can create a plan of action to do things like modify lighting, put in grab bars. Sometimes you can work remotely to accommodate your needs, and then some of them even offer transportation.
What advice can you offer to help prevent caregiver fatigue and burnout?
The old saying of you can't pour from an empty cup is very applicable for caregivers. You have to prioritize your own health in order for you to care for your loved one. In this instance, the traumatic brain injury survivor. It's not selfish to take care of yourself. I recommend that people join traumatic brain injury specific support groups speak with counselors, speak with your own primary care physician and let them know what's going on. Don't forget to eat. You have to eat well. Your nutrition should be a priority. You have to sleep. Maintain your own hobbies and things that you enjoyed. If it's reading a book, crocheting, going for a walk, have somebody that you can vent to is crucial. Just kind of get it off your chest. It can make you feel better. And don't be afraid to ask for help from friends and family or neighbors, even if it's just as simple as to go take a shower.
Do you see patients needing mental health care after they get back home to get through the recovery time?
I do, and it's sometimes difficult to assess during the acute phase of hospitalization, depending on where the patient is in their recovery. The effects of a trauma might not be evident until later. Caregivers act as huge advocates for traumatic brain injury survivors if they notice signs like emotional distress, irritability, nightmares. There can be flashbacks from the traumatic injury or avoidance of reminders of the incident. All of these might be indicative that the survivor has some post-traumatic stress.
Now, what about the mental health of the caregiver? I know you mentioned traumatic brain injury specific support groups. Does that help take care of the mental health care needs of the caregiver?
The support groups are also for caregivers too. The Brain Injury Association of America, and then there's a subdivision, the Brain Injury Association of New York. If you go on those websites, they have specific information and support groups for caregivers. They even offer virtual support groups, and I think it's huge in helping caregivers. And the other aspect of it is the traumatic event itself can cause a ripple effect for the survivor and the family. Sometimes the caregivers might be the one who found a patient after they fell or they received that phone call from the police or the hospital that their loved one is in the hospital. So it's difficult and they're going through this process as well.
Are there other resources or supports in the central New York area that you would like people to know about?
Absolutely. And I'm happy that you asked. Again, there's the Brain Injury Association of America, the Brain Injury Association of New York. Valuable information. They have plenty of links, plenty of websites. They even have a phone number that you can call to give resources of anything from medical equipment to if you need a break, which is called respite care for the caregivers. It gives links to that and information. There's also a nonprofit, the Concussion Alliance organization. The Office of the Aging in your county can give you valuable information and resources. The New York State Department of Health. The VA, if you're a veteran, they have great resources as well. There's the New York State Brain Injury Association, the Brain Injury Coalition of Central New York. There's local programs such as Access CNY, Liberty Resources, and then the Trauma Survivors Network as well.
There's a lot, it sounds like.
There is. It's just kind of knowing where to go and also being comfortable to ask questions.
Well, Nurse Port, thank you so much for making time for this interview. It was very informative.
Thank you so much for having me. I really appreciate the time.
My guest has been Upstate neurotrauma nurse navigator Melissa Port. The Informed Patient is a podcast covering health, science, and medicine brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.